Hey, future dental assistants, welcome back to
The DAStudySpot, yeah.
I forgot to do that in my last two videos. Why nobody tell me? This is round 3 and the final round of the DANB practice test. There's 10 questions, but these are a little bit tougher. If you haven't done round 1 or 2 already, go check those out and then come back to this video. But before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Let's go!
Question 1. What is the recommended evacuation tip placement for maxillary anterior procedures? A. Lingual parallel to tooth. B. Facial perpendicular to tooth. C. Occlusal surface. D. Away from working area. The answer is A. Lingual parallel to tooth. HVE tip should be placed on the lingual side parallel to the long axis of the tooth for optimal evacuation without interference. Question 2. Which instrument is used to carve occlusal anatomy in amalgam? A. Hollenbach carver. B. T-ball burnisher. C. Condenser. D. Explorer. The answer is A. Hollenbach carver. Hollenbach carvers and discoid cleoid carvers are used to carve anatomical features. Burnishers smooth, condensers pack. Question 3. What is the shelf life of opened glutaraldehyde? A. 7 days. B. 14 to 30 days. C. 90 days. D. 1 year. The answer is B. 14 to 30 days. Once activated, glutaraldehyde solutions are effective for 14 to 30 days depending on the product. Always check manufacturer guidelines. Question 4. Which type of hypersensitivity reaction is anaphylaxis? A. Type 1 immediate. B. Type 2 cytotoxic. C. Type 3 immune complex. D. Type 4 delayed. The answer is A. Type 1 immediate. Anaphylaxis is a type 1 immediate hypersensitivity reaction mediated by IgE antibodies. It's a medical emergency. Question 5. What is the proper technique for loading an anesthetic syringe? A. Hold by needle, insert carpule. B. Retract piston, insert carpule, engage harpoon. C. Insert needle, then carpule. D. Load carpule while needle is on. The answer is B. Retract piston, insert carpule, engage harpoon. Proper sequence: retract piston, insert carpule, engage harpoon into rubber stopper, attach needle, express air bubble. Question 6. Which mandibular injection anesthetizes teeth number 25 to 32? A. Posterior superior alveolar. B. Inferior alveolar block. C. Mental nerve block. D. Incisive nerve block. The answer is B. Inferior alveolar block. The inferior alveolar block, EN block, anesthetizes all mandibular teeth on one side plus the lip and chin via the mental nerve. Question 7. What is the water to powder ratio for type 3 dental stone? A. 50 ml water, 100 g powder. B. 30 ml water, 100 g powder. C. 20 ml water, 100 g powder. D. 45 ml water, 100 g powder. The answer is B. 30 ml water, 100 g powder. Type 3 stone uses approximately 30 ml water per 100 g powder. Type 4 uses less water, about 20 ml for higher strength. Question 8. Which cells are responsible for tooth resorption? A. Odontoblasts. B. Ameloblasts. C. Cementoblasts. D. Odontoclasts. The answer is D. Odontoclasts. Odontoclasts, similar to osteoclasts, resorb tooth structure. This occurs naturally with primary teeth or pathologically with external resorption. Question 9. What should be done if you get a needle stick injury? A. Ignore if minor. B. Wash, report immediately, follow exposure protocol. C. Apply bandage only. D. Wait until end of day to report. The answer is B. Wash, report immediately, follow exposure protocol. Immediately wash with soap and water, report to supervisor, document incident, seek medical evaluation, and follow post-exposure protocol. Question 10. Which statement about chemical indicators is true? A. They prove sterilization occurred. B. They only show the package was exposed to heat. C. They replace biologic indicators. D. They're not necessary. The answer is B. They only show the package was exposed to heat. Chemical indicators, tape, strips, only show exposure to sterilization conditions, not that sterilization was achieved. Only spore test confirms sterilization. All right, y'all, you made it to the end. Final score time. Count up your correct answers out of 10. If you got 9 to 10 correct, perfect finish. You dominated the hardest questions. 7 to 8 correct, strong close, but nice work on these tough ones. Anything below 5, please do not stress. These were designed to be the hardest. You're only going to get better with a little bit of time. Now we're going to add up your total score from all 3 videos, which is a total of 50 questions. If you got 45 to 50 correct, go ahead and schedule that exam. You ready. 38 to 44 correct, you're in the passing zone, but if you just focusing on some of those missed topics, you'll be golden. Any score below that, please know that you're so close. We just need to lock in a little bit more. Drop your final score out of 50 in the comments, and then tell me which part was hardest for you. Want to improve your score? Watch my complete study series, or check out my full study guide that has all the key topics you need to know to pass the exam on the first try. It also includes a 6-week study planner, an exam day checklist, and more practice questions. Now go ace that exam. If you find this video helpful, hit that thumbs up and share with a dental bestie, but be sure to subscribe, and I will see you both on the next video. Bye!